I need. Yeah. Thank you. Good afternoon, everyone. Welcome to the Thursday, August 11 meeting of the Emergency Medical Care Advisory Board. I am Mike Maggard, your chairman, and welcome you to the meeting. We're going to start with a flag salute, and Chief, you're sitting to my right. Do you mind doing the flag salute for us?
Salute. Pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Chief. Thank you. Ms. Richardson, would you please call the roll for us?
Certainly. Supervisor Maggard,
Here.
Chief Williamson,
Here.
Chief Greener,
Here.
Mrs. Barlow, Mr. Miller, Mr. Noyola, Mr. Peters, Mr. Surface,
Here.
Dr. Lyon.
Here.
We have a quorum.
Thank you very much. We have a quick announcement to make regarding the broadcast of our meeting today. This is a change in the way we've handled it. So, Ms. Richardson, would you give us a little quick update as to what we can expect today and what's happening that's different?
Thank you. With the technology advancements and opportunities exist for the division to leverage what is available in an attempt to become more efficient and increase transparency to the public. This will save not only staff time, but reduce costs for the division. So part of increasing this transparency is asking KGov to assist in recording the MCAB meetings. And so starting today, MCAB meetings are being recorded by KGov, and they are being live streamed on the Kern Public Health YouTube channel. And they will also be saved on the Kern Public Health YouTube channel for future viewing. The Board of Supervisor meetings are also live streamed and recorded in the same manner. And so for today and in the future, a link to the YouTube videos will be added to the division website following the meetings. And as we look to implement new processes for technologies, any feedback that the board or any public has would be appreciated.
Very good. Thank you. Let's go ahead and proceed then with our consent agenda. Consent items are indicated on our agenda with a CA following the item, and the first is item 5, the approval of our minutes. Then under item 10, items A, B, and C. Under item 12, item number A. Are there any members of the public or members of the board that would like to pull any of those items from the consent calendar? Don't see anyone. Is there any member of the public that wishes to make public comment about anything that's on consent? Or board members? Okay. Then is there a motion that we approve our consent items as I've read them?
Motion to approve.
Thank you. Is there a second? Thank you. All in favor, please say aye. Aye. Very good. Thank you very much. Next, we'll go to item number 6, subcommittee reports. We don't have any of those today, so we'll move on to item number 7, public comments. We always offer an opportunity for the public to comment at our meetings about anything that is not otherwise on our agenda. If it's on the agenda, then you're welcome to comment about that. We'll have a public comment opportunity for each item that's agendized. But if anybody here wants to say something to us about something that is not on consent, now's your opportunity. Would anybody like to make any remarks to us about an item that's not on consent? Very good, thank you. So we'll go on then to item number 7, public comments. We just did that. So item number 8, public requests. We don't have any of those for today. We have an item of unfinished business, item 9A, and it is scene control policy. And we're going to receive a report from Janet Richardson. Janet?
Thank you. On May 12, 2016, California City Fire Department Chief Jeff Armstrong requested your board reopen the scene control policy. Your board approved a motion to refer to staff and bring the item back to the next meeting with comments on the presentation that was made. The scene control policy was initially developed in 1991 and has been subsequently amended as recently as March 1, 2012. The current version was created through a subcommittee appointed by your board. The subcommittee reviewed multiple drafts of the document, met on at least 2 occasions, and came to an agreement on the language in the policy and the delineation of who has healthcare authority on scene. Membership of the subcommittee consisted of representatives from Bakersfield Fire Department, Kern County Fire Department, Hall Ambulance Service, Liberty Ambulance, California Highway Patrol, the Division, and Supervisor Zach Scribner. The scene control policy, as it relates to the issue brought before your board, outlines the person with healthcare authority as the person on scene who is the most medically qualified. The person with healthcare authority is simply the person who is responsible for making medical decisions regarding a patient. Examples of medical decisions are treatment decisions, destination, or mode of transport. The policy dictates that when 2 or more individuals with the same level of qualifications are on scene, the healthcare authority is with the transporting agency. For Health and Safety Code, the Emergency Medical Services Medical Director has the ultimate authority to determine how patient health care authority is assigned. The Medical Director asserts that the current policy best meets the needs of all residents in the county based upon the best interests of each patient and the capability of available resources. The Division requested County Council's opinion on the Health and Safety Code requirements in conjunction with our local policy. County Council offered an opinion that Kern County scene control policy is compliant with current state laws. The authority to designate a patient health care authority and delineate medical responsibility on scene within the confines of the law rests with the Division's medical director. The Division also conducted an internet search of local EMS agencies throughout the state. Currently, 12 other LEMSAs have policies identical or closely similar to Kern County's, in which the transporting paramedic is vested with healthcare authority. There are 11 LEMSAs that have policy outlining healthcare authority similar to what was suggested by California City Fire Department Chief Jeff Armstrong. More than half of these 11 LEMSAs have fire departments within the jurisdiction that are capable of transporting patients. There are 3 LEMSAs which do not have a policy at all. But in all cases, as authorized by Health and Safety Code, the Division Medical Director has the authority to establish policies within the best interest of each respective jurisdiction. And this concludes my report, and I'm available for any questions.
Thank you very much. Before we go to the public, do any members of the board have a question they'd like to ask? Okay, we always offer an opportunity for the public to speak. Does anybody here today want to speak to us about the report that's been received?
Of course, didn't think I was not going to comment.
Can you give us your name for the record?
Just wait for the microphone. Jeff Armstrong, Fire Chief, California City. I'd like to thank Jana for her emails. I sent her an email yesterday. I had a few people on the thread. Was having a hard time finding a policy that was buried in my email somewhere, and I want to thank her for that. And if the email offended you in any way, I want to apologize for that.
Excuse me, sir. Can you make sure that you turned your mic on?
It's got a blue line.
Just point it towards you a little more then. Thank you.
Sounds good. So probably a few people in this room are kind of sighing of relief. This is over. We've looked at it. Sadly, it's not. And unfortunately, I'm put in a position where the fight is going to continue on this. I respect EMS's policy. I respect their opinion, but I do not agree with it. Kern County EMS may be telling you that everything is great, but it's not. We have a problem, and our voice is not being heard. Another miscommunication that Jana and I had was over the last 3 months, I expected the providers to be given an opportunity to meet with EMS and provide our data, expound This isn't about who has better paramedics, it never has been. Despite the issues we encounter rarely on scene, most operations are seamless and supportive between the public agency and private company. We recognize the service and the private ambulance provides to our community, and we wish to have a strong, mutually beneficial relationship. But patient care will not come second to this. I am on the right side of this issue, and I've been through this same struggle before in other areas of the state. I've heard it all. First responder paramedics don't understand. They work in a different environment. We need consistency. We need to get them back on the fire engines and available in their first due. All great points that need to be discussed and need to be fully explored. The impacts on an agency are fully understood when you stand up and you want to put paramedics on your fire engine. And I encourage anyone who may be in the room or in the audience online that are thinking about ALS capabilities in the future, study the impacts to your agency. If you really want to know what this is about, I'll come out and tell you. I don't have hidden agendas. It's not about ambulances. It's not about 201 rights. It's not about fire transporting or wanting to necessarily retain patient care all the way to the hospital. This is about, the basis of this issue is about our paramedics' ability to order appropriate resources, specifically air ambulances in rural California City, and make decisions to fly a critical patient and not have that undermined or overruled 8 to 10 minutes later. We've documented significant time savings. Besides the savings to trauma patients, we've documented significant time savings that air ambulances provide to Cal City, specifically a 12-minute ETA to AV hospital, documented 12-minute ETA. But I've explained all this at the last meeting. I've explained it in my presentation to Kern EMS, my data, my research, very in depth. We've talked about how we are advocating for a policy revision that allows us to continue this uninterrupted care on critical patients, establishes first ALS contact, and brings us in line with the rest of the state. We don't seek to take away the revenue from any private ambulance company. We don't seek to state that we are a better paramedic agency than any other private company. But I have provided data and specific incidents to EMS and to the private ambulance provider that provides service for Cal City on specific incidences where we had issues, where patients should have been flown based on the signs and symptoms presenting in the field. In return, there's been no discussion or data provided, not publicly anyway. I think the only person to speak on this last time was Mr. Brandon from Liberty, who said, the only one who's unhappy is Cal City. Well, yeah, we're the only ALS fire department. His argument was it works great. Is that your data? Is that what I'm being presented with? Since MCAB, I have met with John Surface at Hall Ambulance, and I'm working to really work on that relationship with John. I'm convinced, however, he and I are never going to agree on a methodology or a solution here. While we follow the #1 rule of paramedicine, treat the signs and symptoms and don't diagnose in the field, the ambulance company, on the other hand, identified their methodology as trying to determine on whether or not a patient will be admitted to the hospital before they fly. That goes against the #1 rule of paramedicine when I went to paramedic school in 1999. Things may have changed, perhaps. I'm not going to argue for ultimate authority, but rather a unified command solution as identified in the Health and Safety Code. Yes, I've studied it in depth. Yes, our city attorney has looked at it. Yes, I've studied case law. I would remind you that the Health and Safety Code does place public safety employees, quote, in charge at emergency scenes, end quote, period. I'm asking for a policy that meets the intent of the law, unified command, and doesn't require me to decide between local policies, potential letters that I may get in my file, or upholding the law to save a life. Thank you for your time.
Thank you, Chief. Boy, that's a hot mic. Any other members of the public wish to make comment this afternoon? Okay, we'll close public comment then, return to the board. Do we have any comments or questions to be asked by members of the board regarding the presentation? I have one for Ms. Richardson and probably for our counsel, GK. If the chief from Cal City has a disagreement with the policy, what prevails? What will be the response on the scene? Will the policy as it's been presented and has been promulgated by the county, that is what will prevail, is it not? Okay.
Just to add on to that, Mr. Chairman, to the report that was presented by Jana Richardson, County Council has taken a look at the policy, has taken a look at the Health and Safety Code. We've taken a look at the applicable case law in this area, and we feel that the policy is consistent with the statute and with applicable case law. So We can certainly provide more detail on that, but I think in answer to your question, the short answer is the policy as it stands now is appropriate and would be applied.
Any other comments by you, Ms. Richardson?
No, Chairman.
Okay. Do any members of the board wish to modify anything about the report? And if you do not, then it's appropriate for us to make a motion to receive and file. Do we not wish to receive and file? Then does somebody want to make another motion? Do we want to modify it in some way? Does anybody have other comments about it?
I'll move to receive and file,
Thank you, Chief.
Chairman.
We have a motion and a second. Any other discussion? All in favor, please say aye.
Aye.
Anybody opposed to that? Okay, thank you very much. Thank you for your report. We've dealt with item 10, new business under consent. Item number 11 is a director's report. Ms. Richardson.
Thank you, Chairman. I've got 4 items I'd like to update your board on concerning our division. So the first item that I have for you is, as reported during the last meeting, the division has recently experienced some turnover in staff. We are pleased to announce the hiring of 2 EMS coordinators. George Baker joined the division on May 31st, 2016. Mr. Baker, raising his hand there, brings with him over 22 years of experience as a paramedic, all of which are in Kern County. Mr. Baker has been assigned the continued development of the Emergency Medical Services for Children program, advanced life support programs, and the protocol redesign, to name a few of his new assignments. Nick Lidgett joined the division June 6, 2016. Mr. Lidgett has several years' experience as a paramedic working for private ambulance companies as well as safety personnel in the oil industry. Mr. Lidgett has been assigned the role of the Regional Disaster Medical Health Specialist for Region 5. And this is a funded position by a state grant to provide mutual aid planning and coordination for the entire Region 5 area. Mr. Lidgett is also assigned performance compliance responsibilities. The division has 1 additional EMS coordinator position available and has been conducting interviews, and it's anticipated that we will fill this vacancy in the near future. That's my update there. My next update is for Sidewalk CPR Day. The first week of June serves as National CPR Week in the United States. So as part of this recognition, the division partners with community stakeholders to support a county-wide Sidewalk CPR Day. This was conducted on June 1st, 2016. The division worked with local community partners that participated in training residents in hands-only CPR. We'd like to recognize our partners that assisted us, which consist of the Bakersfield Fire Department, San Joaquin Community Hospital, Liberty Ambulance, Delano Regional Medical Center, Kern Medical, Ridgecrest Regional Hospital, Bakersfield Heart Hospital, Hall Ambulance Service, and the Kern County Fire Department. This year, 845 members of the public were trained in hands-only CPR. And since the inception of Sidewalk CPR in 2012, we have trained over 6,000 community members in hands-only CPR. Kind of piggying back on the Sidewalk CPR is Pulse Point Respond. We've been talking about this a couple of times throughout the last year. Pulse Point Respond is an app for Android or Apple smartphones. It alerts nearby citizens of the need to perform CPR when a person who's within walking distance goes into sudden cardiac arrest. So users of the app indicate that they are trained in CPR, meaning that they just know how to perform hands-only CPR, and they accept the option for the push notifications. Through active citizen responders, it improves the cardiac arrest survival rates in the communities in which it's been deployed. So the software is installed on the server up at the Emergency Communication Center, which is the fire department dispatch. So when a cardiac arrest is inputted into the computer and it's in a public location, the software will push the information to the app users that are within walking distance of that victim. We began an internal testing phase on June 17th, 2016. Members of the division, public health, ECC, and the California City Fire Department participated in the internal testing. A soft launch was initiated on July 7th, 2016, where the app was shared with public health staff, EMTs, and paramedics countywide. And then finally, Pulse Point was launched community-wide on July 14th of 2016. Public Health Director Matt Constantine opened a press conference with Dr. Lyon, and a public health nurse director and sudden cardiac arrest survivor mother, Michelle Curioso, as speakers. Members of Kern County Fire Department, Bakersfield Fire Department, and California City Fire Department were all present for the press event and available for interviews and questioning. And division staff also gave a presentation in hands-only CPR and AED use. We are continuing to promote the use of this app through billboard media, postcards, and public service announcements in local movie theaters. So if you guys go to the movies anytime soon, you'll see our commercial running. As of yesterday at 2:15, we have 638 citizens in Kern County with the app downloaded. So we hope to continue to push the app and increase our citizen download rate. The last report I have for you, or the last update really, is concerning the Erskine Fire. So the division played an essential role in the recent Erskine Fire. When the fire initially broke, EMS division was activated to our Department Operations Center, our DOC, and I was requested to respond to the EOC. The reason for these activations was that Kern Valley Hospital was located within the fire danger zone. We worked to prepare to evacuate the hospital that evening, including attempting to locate places to send patients once they were evacuated. After a lot of phone calls and conversations with the hospital, California Department of Public Health, ambulance service providers, Kern County Sheriff, and the Kern County Fire Department, it was determined that evening that the hospital was no longer threatened by fire and that a shelter in place was the best option for the evening. The second day of the fire, the division continued to search for beds to place patients should the need arise to evacuate the hospital. By early evening, the division located more than enough beds for these patients. The hospital patients were already being transferred out throughout the day, which left only skilled nursing patients. Transportation was arranged through the use of buses and ambulance. And when word was received by the division to evacuate, it was just a matter of putting the players already in place into motions. The division would like to take this opportunity to thank all agencies who provided assistance with the evacuation. Most of these agencies received several phone calls from us throughout the entire day from division staff. So not only do we appreciate the efforts that they put forth to accomplish the mission, but their patience and diligence in helping us coordinate the effort is greatly appreciated. So Liberty Ambulance Service provided several ambulances throughout the day and transports throughout the day. Hall Ambulance Service provided, I believe, 15 ambulances, a bus, and some vans to help transport nurses. The nurses were used to help facilitate transport of the patients that were able to go on a bus down so that they would have medical supervision. Kern Regional Transit provided 2 buses for us. Golden Empire Transit did not provide services, but they offered to even just put their administrators to drive buses if we needed them to. Health South, Evergreen Tudor, and Arvin, and they also offered a bus. Lifehouse on 34th Street, Lifehouse on Real Road, Rehab at Bakersfield, Brookdale, Good Samaritan on Olive Drive, Rosewood, Memorial Hospital, Delano Regional Medical Center, Golden Living Center in Shafter and Bakersfield, San Joaquin Hospital, Mercy Hospital, Kern Medical, Ridgecrest Regional, and Belisara all played a role in helping us to coordinate this effort. So at the end of the day, 66 skilled nursing patients were transported total, and from the start of the evacuation to the last patient leaving the facility was 4 hours. So this concludes my director's report. I'm available if you guys have questions.
Very good. I'd like to say that the response from across the emergency services spectrum and many other aspects of the county was remarkable. And whether it was providing shelter or a place for animals that people were frantic about, or helping them contact their family, or getting meds to people that their meds were left in their house and they were separated from them, even if their house was there, their medicine wasn't with them. It just was remarkable, top to bottom, side to side. And I don't take for granted. I know that while the public may enjoy the security of sleeping under a blanket of security that is provided by all of the providers that are represented here, they were well served, and I'm just grateful to all of you for what you've done. So thanks to everybody who's involved in that. Any questions or comment about her report? Any members of the public want to make a comment about it? then it would be appropriate for us to receive and file it, I think. Do we typically do that here, GK?
Yes.
So is there a motion to receive and file the director's report? Is there a second? Thank you very much. You get that? All in favor, please say aye. Aye. Is anybody opposed to that? Thank you very much. We've dealt with item 12, miscellaneous documents, already in our consent, so item 13 is board member announcements. Do any members of the board wish to make a report on anything that they've been up to, or ask questions, clarification, ask for something to be agendized, anything like that? Yes.
Chair, I would just like to echo your thanks to all of our first responders and community agencies and private and public entities that responded to the Erskine Fire. I'm a resident of Kernville, and I'm very familiar with the devastation that occurred both in South Lake, Mountain Mesa, Squirrel Valley, across the Kern River Valley. There are real lives and faces that I can put to that tragedy, and I can tell you that your response made all the difference in the world to their safety and their security and eventual recovery. So I just want to say thank you very much on behalf of the Kern River Valley. Thank you.
Well said, thank you. Anybody else like to say anything? Yes, Mayor?
Well, I just want to introduce myself. I'm Randy Miller. I'm mayor of City of Taft. My background is I've had 14 years on the West Side Hospital District Board, and then we were in the midst of selling it to Catholic Health Care West, and we had changed it from a hospital board to a West Side Healthcare District. So I have a little experience in the medical field. And then I've been on the city council since 2002. I'm in my 14th year, and my second go around as being mayor. So I'm just a little new here, getting used to what's going on, but I just want to let people know that, you know, I do have a little experience, so I hope I can be able to contribute to this board, because it is important.
Mayor Miller, you beat me to the punch. I was going to congratulate you for being on our midst today, and I'm glad you introduced yourself, and we look forward to your participation.
Well, thank you.
I have not worked on the board yet with Mayor Noeola from Arvin as well. Is this your second meeting, or is it your first meeting? I was gone the last meeting.
Chair, although I would say it's prestigious that you promoted me to mayor, I'd prefer to stay as city manager.
Oh, sorry. I had that wrong. I apologize.
But as part of the Kern County mayors and city managers, I'm the city manager representative on the board. So I think this is actually my third meeting now.
Third. Okay.
So it's been very interesting, and for you know, whatever I can do to participate and add to the discussions, certainly am here to do that, and also represent, obviously, the cities here in Kern County.
If you'd stir up more trouble, I'd have down pat how to manage you, so thank you. Any other members want to make any comment? Okay, very good. Appreciate your guys' participation today. I have a couple of announcements to read under item number 14. Our next regularly scheduled meeting is Thursday, November 10, 4 o'clock in this room, and the deadline to submit requests to agendize anything for that meeting is Thursday, October 27th at 5 p.m. And you can submit those through the EMS Division Senior Emergency Medical Services Coordinator. Any other business before us? Great. Thanks, everybody, for your participation today. I would entertain a motion to adjourn. Thank you very much. Without objection, so ordered. Thanks, everyone.